Hi there, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. All right, today we're talking about what athletes need to know about stem cell therapy. Is it legal? Is it not legal? Do you need to file for a TUE? Well, the U.S. Anti-Doping Association has a section on its website about stem cell therapy for athletes. Now, the USADA pretty much follows the World Anti-Doping Association, so I wanted to state a few things up front. Now, PRP, which is where an athlete would have his or her own blood taken, spun quickly in a centrifuge to concentrate growth factors and platelets, and then placed into an area of injury, that is completely fine. All right, there's no issues with PRP. Now let's talk about stem cells. Now on the USADA website, there's some accurate information and there's some inaccurate information. What's the real deal? So there's two different ways to receive stem cell therapy, basically. One is with your own tissue, that's called autologous. Auto means self. And then there's allogenic, which is from a donor. So let's touch on the autologous first. The autologous is either going to entail tissue from your fat, which is called adipose, either from the belly or from the flank, or bone marrow. And usually the bone marrow is taken from your pelvis, your iliac crest. Now, the provider may take that tissue, process it in the clinic right then and there, and give it back to you. And that's completely allowed in the United States and all over the world. All right? That's okay to do. One of the problems with that is you don't get many stem cells from doing that. One of the better ways to do it is, if you're going to use your own fat or bone marrow, is to have those cells expanded. You're not allowed to do that in the United States. They call it a drug when you do that. But you can do that internationally. You're going to need to make multiple trips. Okay? You're going to have to go, give your bone marrow or adipose, and then leave, and then come back in a few weeks after they've had time to expand the cells. That is typically legal outside the United States. It's allowed unless they put extra growth factors or HGH or something inside the with the cells. You could have a problem, but otherwise, no, there's nothing performance enhancing about it. All right, so that's the autologous way. The allogenic way doesn't involve your tissue at all. It may involve some blood to make PRP. That's not a stem cell procedure. We use umbilical cord derived stem cells. Now those are obtained from a donor, and the process entails a lot of clinical screening to make sure there's no significant risk factors like opioid abuse in the donor, or tattoos, or travel, or disease history, family history. It's a lot, okay? Now, when the tissue itself is obtained after a scheduled C-section, it's then brought right away to the lab, and it's processed at our lab. It's under GMP conditions, pharmaceutical grade. We don't use any animal reagents, nothing that has weird enzymes in it. You know, it's very strict quality control. We abide by the FDA regulations of how that tissue is processed. All right. In the United States, when we process the umbilical cord tissue, it can be used in procedures in the United States. All right, we're not allowed to expand the cells. We don't culture them in the United States, but the umbilical cord tissue itself is processed in such a way that it's called minimal manipulation, and that abides by the FDA regulations for the United States. Now, if you wanted to get expanded stem cells, many, many more, then we do that outside the United States in 6 countries. And what we do is we take the umbilical cord tissue, we separate out the best stem cells, mesenchymal stem cells, from the umbilical cord. Those are the ones we expand. We go up to the maximum of a 5th passage, which is totally fine. The stem cells are pure, potent, active. And then those are the ones that we administer. So is that allowed to an amateur or professional athlete? The answer is yes. It is not a performance enhancing drug or substance. Okay, so if you get those, there's at one of our clinics, there's no performance enhancing proteins or medications or HGH or anything that's on a banned list. All right, we've done this for over 10 years now with many elite athletes, amateur or professional ranks in many different sports, and it's never been an issue. But there's a lot of misinformation out there with regards to what's allowed and what's not allowed. So let me explain what's happening when you get a stem cell therapy as an athlete. All right, let's say you're functioning at 100% as an athlete. You don't have any significant injuries. You're very ready for competition. All right, so you're at 100%. Okay? Now, if you use an illicit substance, something off of the banned list, you may go to 200%. Okay? So what happens with a stem cell therapy? We're talking about recovery. So let's say you go and you train hard and for a long period of time, getting ready for competition, and you're starting to get sore, you're starting to hurt, you have some injuries that you're dealing with, so you're down to like 50%. Right? Stem cell therapy in the athletes that we treat routinely tells us that it helps them to recover faster, and they're able to train harder and compete better. Okay? So it's not taking them past 100%, but it's making them have less time to recover. So we have bodybuilders, we have track and field athletes, football, baseball, basketball players who say that. I mean, think about going through a full season. It's a long season. It could be 6 months. There could be games every other day, or in the case of baseball, almost every day. That's a lot to put your body through, especially with each advancing year. All right? So what we're doing is we're not telling athletes, hey, we're going to take you here and put you supra-normal, and skirt that line of popping positive or something. No, we're just helping people get back to 100% faster, so you can compete better, train harder, so on and so forth. All right? So that is what stem cell therapy does for athletes. There was a nice article in Sports Illustrated talking about the use of stem cell therapy in athletes, and they listed about 8 or 9 different examples. Peyton Manning, Tiger Woods, so on and so forth. But I don't think that people really understand just how common it is, and athletes just don't talk about it. But during the season, in the off season, athletes are using them frequently, either autologous or allogenic. Why? Because of what I just said. It helps them recover faster, and it's not a prohibited substance by any stretch if done properly like we do at our clinics. Visit us online today at r3stemcell.com. Our YouTube channel has over 900 videos, and call us to schedule your free consultation at +1 844-GET-STEM. You can also email us at info@r3stemcell.com. Thank you.